Hi, this is Das from Das Edu. Today I will discuss the topic electrocardiogram or ECG. On the very first slide over here, it is shown a typical 12-lead ECG, and this particular 12-lead ECG will tell the condition of heart of any patient very clearly, and how to interpret and what the meaning of what lines we can easily predict or we can easily interpret after completion of the ECG topic. Okay, so right today I'll discuss about the mechanical heart functioning of the heart, how heart functions and its electrical activity, and with that, with a simple heart functioning interpretation at the very last. So right here on this particular diagram, I have tried to draw one heart's 4 chambers, and the particular chambers are right atrium, left atrium. Okay, so the upper part of the heart is called the atria, and the lower part of the heart is called the ventricles. Okay, so over here, this is the left atrium, right atrium, left ventricle, right ventricle, and there are two important node as per our discussion of ECG is sinoatrium node and AV node, atrioventricular node. Okay, so the heart chambers and nodes, in my discussion, the important chambers are right atrium, left right ventricle, sinoatrial node, and atrioventricular node. These particular chambers or nodes are important on my discussion. So I have taken these chambers and nodes only over here in my consideration. Okay, so now the blood circulation pathway through the heart. Impure blood firstly come through the right atria through the two ducts, namely superior vena cava contains the blood from the upper part of the body, and the inferior vena cava contains the blood from lower part of the body. Okay, so this particular impure blood comes to the right atria through these two ducts. Now, when the right atria is filled up with this impure blood, it contracts and pushes the blood into the right ventricle. Okay. Again, when the right ventricle is filled up with that impure blood, it pushes the blood into the lungs. Okay. Now, the lungs, there are important functions of purification of the blood or oxygenation of the blood. And here I discuss how the purification method is going on inside the lungs. Inside the lungs, there are very fine sacs called alveolar sacs. Okay, so inside the alveolar sacs, there are the blood rich with carbon dioxide. Now, from where this carbon dioxide comes? From the right ventricle. From the right ventricle over here in the last point I mentioned that from the right ventricles, the impure blood, impure means the blood with carbon dioxide, rich with carbon dioxide, it pushed into the blood, into the lungs. Okay. So now this particular blood rich with carbon dioxide gets inside this particular alveolar sacs. Okay, so inside the sacs there are blood rich with carbon dioxide, and outside the sacs we have air rich in oxygen. From where we get the oxygen? As we inhale, we take oxygen from the air, fresh air. So we assume that we have inhaled the air rich with oxygen. So outside the sacs there are air rich in oxygen, and inside the sacs there are blood rich with carbon dioxide. So what happens next? As inside of the sacs are full with blood rich with carbon dioxide, so the partial pressure of carbon dioxide is high inside the alveolar sacs, and it pressures this particular carbon dioxide to go out, and as air rich in oxygen is filled at the outside of the sacs, and the partial pressure is high. So this oxygen tries to come and gets inside to this particular alveolar sacs. This particular process of exchange, we call it oxygenation or purification of blood. So the process repeats as the blood rich with carbon dioxide is inside the sacs. Outside the sacs, we have air rich in oxygen. So as the partial pressure of carbon dioxide inside high, so carbon dioxide tries to reach outside of these lungs, and as air reach with oxygen outside the sacs, it tries to get inside the sacs. Okay, so in this method, the purification of oxygen or purification of blood or oxygenation of blood takes place inside our lungs. Now, the pure blood goes into the heart by the process is that the purified blood comes into the left atrium. Left atrium pushes the pure blood into left ventricle, then the blood goes into the whole body when the left ventricle pushes this particular blood, it goes to the whole body. And whenever any chamber of the heart contracts, pressure of blood builds up, and there are some non-return valves inside or in between the atrium and ventricle, which will not allow the blood go back, and this moves forward only. So it is never possible for the blood to go from ventricle to atrium. It only goes from atrium to ventricle and ventricle to whole body, or otherwise towards towards the lungs. Okay, so this is the process of mechanical heart pumping. Now we have a very little interest on how the particular blood pumped mechanically. Okay, so I'll show one video over here how the blood particularly pumped, and you will get clear with this video. Okay, so here this video shows you that there are some superior vena cava and inferior vena cava. Through the superior vena cava, the impure blood comes from the upper side of the body, and the inferior vena cava brings the carbon dioxide rich blood from the lower body, and it brings towards this particular right atrium. Okay, then through the tricuspid valve, it is again a non-return valve. I mentioned this non-return valve will never allow the blood goes from ventricle to atrium. It will allow only one directional blood flow, that means from atrium to ventricle only. Okay, so this particular blood is now pushed to the right ventricle. Now right ventricle pushes this particular blood to the pulmonary artery, through the pulmonary artery towards the lungs. Here inside the lungs, there are the oxygenation of blood or purification of blood takes place. Then from the lungs, this particular blood, that means oxygenated blood, comes through the pulmonary vein towards the left atrium. When the left atrium is filled up, it pushes through the mitral valve towards the the left ventricle, and this particular mitral valve is again a non-return valve, which will never allow the blood is being pushed towards the atrium again. Okay, so with these two valves, bloods never come or go back to the atrium. Okay, so now when the left ventricle is filled up with blood, it goes through aorta towards the whole body, and it is get distributed. So this was the mechanical heart pumping or blood pumping of heart. Now we will get back towards our electrical conduction pathway of the heart, and we will focus on how electrical signals are generated inside the heart, how the RMP is generated, how the action potential is generated, whatever inside our heart, and how can we measure. Okay, so the electrical aspect is in the background. The electrical activity starts at the sinoatrium node, SA node. contains some cells which are called pacemaker cells. So what a pacemaker? Some of the students wrongly answer here that the pacemaker is some electronic cell which generally generates some pulses. This answer is wrong. Okay, so whenever a pacemaker, you are asked a pacemaker, what is a pacemaker? First try to answer this one, that the electrical activity starts at sinoatrium node of a heart, and this particular node contains some cells to be called pacemaker cells. Okay, so students never make this particular mistake. Okay, so whatever, the pacemaker cells action potential is like this. Okay, this is the y-axis is representing the millivolt, and the x-axis representing the time, meter per seconds. Sorry, millisecond. Time is in millisecond. I apologize for my mistake. Okay, so the RMP is like that. It is depolarizing, then repolarizing, depolarizing, then repolarizing, like that, and the cycle is going on. Okay, with the infinite time. So this is the action potential wave shape of the pacemaker cells situated at the sinoatrium node. Okay. Now, the action potential of the pacemaker cell is that the RMP, or the resting membrane potential, automatically decreases and reaching to some values called threshold. Okay, so this RMP, this is the resting membrane potential at the lowest point. It is the resting membrane potential. It decreases to some point to the threshold. It reaches to the threshold, then repolarize to its RMP, and this particular automatically decreases to reaching some values called threshold. Okay, then depolarize, repolarize, depolarize, repolarize, cycle. This cycle gets repeated. This is basically an equivalent of a free running multivibrator. Okay, which automatically generates some pulse train. You know, the free running multivibrator or a stable multivibrator, you can replace this particular RMP or the AP of the pacemaker cell. You can compare with the free running multivibrator's output with it. Okay, so I have taken an example over here only. So now this equivalent to a function generator, which is called a biochemical function generator. Now the electrical conduction pathway, now these pulses generated at the pacemaker cell now carried into the heart. Okay. Now the velocity of the pulses of 1 meter per second. Okay, I was over here, so sorry for the interruption. The pulses generated as at the pacemaker now carried into the heart. That means the upper part of the heart. Velocity of the pulses is now 1 meter per second. It reaches to the upper part. When it reaches to the upper part, the atria contracts. After contracting the atria, these pulses reach to the next node, the AV node, and at the AV node, this pulses velocity decreases to 0.1 meter per second. So what happens over here? The pulses are generated at the pacemaker cells, now getting carried into the heart, and the velocity of the pulses was 1 meter per second. It gives some strong contraction to the atria, and the upper part of the heart contracts, so that the at the left atria impure blood, and at the right atrium, pure blood, oxygenated blood, contracts and push towards the ventricles. Okay. So now after contracting the atria, these pulses now reach to the next node, the AV node. Okay. Here in the AV node, the pulses decrease to 0.1 meter per second. Now the purpose why these particular pulses velocity has been dropped down from 1 meter per second to 0.1 meter per second, there is an obvious reason is that the velocity decrement is to give a time delay between the contraction of the upper part, means the atria, and the lower part, means the ventricles. That means if the pulses which was generated at the SA node of 1 meter per second would reach the AV node at the same velocity, that means 1 meter per second, then the function of the SA node was to give a strong contraction to the upper part of the heart, that means the atria would be contract, and the function of the AV node to contract the lower part of the heart, that means the ventricles would be contracted. So if the pulse's velocity would be the same, then at the same time atria and the ventricle would be contracted. Then the entire heart function would be malfunctioning. So the thing is that at the same time, the upper part of the heart and the lower part of the heart can never be contracted. There would be chaos. So when the particular upper part of the heart contracts, the lower part of the heart must be relaxed so that the pump blood from the upper part will be collected at the lower part. But if both the parts are contracting at the same time, then there will be a obvious malfunction and chaos in the heart, and there will be some malfunction. So this particular velocity decreases from SA node to AV node by 10 times. Okay, so this is the reason why the velocity of the pulses has been decreased over here. Okay, so now after contracting the ventricles, the pulses will travel very fast. Velocity will be 2 to 4 meter per second through the nerve fibers to be called left bundle, which is called bundle of His, and the right bundle, bundle of Purkinje. Okay, when the upper part atria contracts, the lower part, the ventricles must be expanding, and vice versa. Okay, so this is the normal electrical heart pumping or electrical activity of the heart. Now, the summary of this particular discussion is SA node is just like a free running multivibrator which generates some pulse train, which I have shown over here. Okay, so it reaches to some threshold, okay, depolarizes, then repolarizes, then depolarizes, then repolarizes, like that, and its comparison is with like some free running multivibrator. The pulses reaches the upper part. Okay, so the upper part contracts. The AV node gives a time delay, then the lower part contracts. Now the important function of AV node is that if SA node fails to generate that particular pulse train, okay, then AV node tries to maintain rhythm at lower frequency and allow SA node to recover. This particular function of AV node is called demand pacing. Okay, so sometimes the SA node fails to generate the pacemaker cells that particular action potential. Okay, at that time, AV node will try to maintain the rhythm of the heart and will try to give the pulses which is generated at the SA node, such that at the given time, if the SA node was failure, then it was giving some lower frequency pulses to the SA node, such that the SA node will recover and started functioning. Okay, this particular function is called demand pacing. Okay, now criticism of this particular theory is that upper part and lower part must not contract simultaneously. Obviously, there will be some malfunction of the heart. AV node should not generate any pulses when SA node is operating. Then there will be obvious malfunction. Both the nodes or the SA node, when it is generating some operating at its frequency, then AV node if gives some demand pacing, then this will be a chaos. Okay, so if AV node gives a pulse by mistake when heart is expanding or relaxing, it leads to chaos and the entire control will fail. Okay, now we come to the ECG wave shape. This is the particular wave shape of the normal ECG, right? At the y-axis, it represents voltage in millivolt. At the x-axis, it represents time in second. So over here, we can see that there are some P wave, then PQ segment, then some QRS complex, then ST segment, then T wave. Some of the books are referring to U wave, whatever. My discussion will be limited to T wave only. Now, what the particular wave or complexes represent what? Let us discuss is that ECG wave shape for the P wave, it contracts, means the upper part contraction. Okay, that means the atria contraction. QRS complex represents upper part expansion and lower part contraction. T wave represents the relaxation or expansion of the lower part. And now there are two segments, ST segment and PQ segment. Okay, so now I'll take one example of ST segment over here, abnormal ST segment, for an example. Okay, critical diagnosis from ECG signal. Heart has its own blood circulation as discussed. Let's suppose now there is a blockage in the heart and the condition is called cardiac ischemia, where the ST segment goes down. This is called ST segment depression. Okay, normally the ST segment is parallel or on the x-axis. Okay, so now due to some blockage inside the heart, if we take the ECG, this is called cardiac ischemia, and this ischemic condition, ST segment will go down and it will not be parallel with the x-axis or on the x-axis. Okay, so the ST segment depression will come. Now let us suppose the condition is more acute, more blockage, more obstruction. The patient is having chest pain right now with some vomiting tendency. This is called myocardial infarction, or this particular, in this case, the ST segment must be much more depressed. But here we will see that the ST segment will be elevated. Okay, first, while the condition of blockage, ST segment got depressed, but while the more accused condition, more obstruction while noticed, the ST segment gets elevated. Obviously a confusion. At the first, when there is some minor blockage, ST segment was depressed, but when there is more obstruction, ST segment should much more depressed, but the ST segment gets elevated. So, in apparently more ischemic condition, ST segment should be more depressed. Instead, it gets elevated like this. It is a complex manifestation. Okay. So, in this case, this is the one of the most complex manifestation and the assumption of the physician what actual thing is happening. Though heart is the most well understood segment in the physician's theory. Okay, so whatever, this is the particular example we have taken of ST segment depression or myocardial infarction, whatever you may call. Okay, so our discussion ends here. If there is any questions, you may ask me. Obviously, you may contact me on my email ID, thuseduquestion@gmail.com. I'll be glad to answer your all the questions. Thank you guys. Thank you very much.